Welcome to episode 7 of Utopian Unfiltered, based on our theme Utopia in Public Policy and Health, SRHR Perspective. We have among us a very experienced person, Shrirupa Sengupta ma'am, with around 14 years of experience in the public health sector. So, ma'am started her career as a youth reporter for the Telegraph and Hindustan Times, worked in the policy space with the adolescent education program and young migrants, then led the Indian contingent as president for the Indo Japan Students Forum and underwent intensive training on writing policy for youth and HIV/AIDS with UNAIDS. Then she started working as a technical officer at the National AIDS Control Foundation NACO. Then she has been also been an independent consultant in the areas of strategic advice, capacity building, content development. She was communications coordinator at Swasti Health Resource Center, then promoted to next level as communications manager, then associate director, and then finally to the being a director, the Center for Strategic Communication for Public Health. She is also a senior facilitator and coach at Unbox Experience. With so much experience and knowledge about public health, SRHR, and public policy, I'm honored to have such an esteemed guest here with us for today's podcast. We welcome you, Shrirupa Sengupta ma'am.
Thank you so much, Shivani. I had forgotten half of this. But thank you. Thank you so much. It makes me feel very nice. And it's my honor and my pleasure to be here. I think the work that you all are doing is fabulous. And I'm so happy to be here. And I'm extremely proud of you as well. So let's hear what you have for me.
Thank you, Shri. So, Shri, basically, we are working on this podcast, Utopia Unfiltered, as part of our college project. So, where we are trying to understand different perspectives that revolve around an ideal society. So, we started this project with the street interviews where we interviewed common people and brought about different opinions. And it's available on our Instagram handle as well. So now for this podcast, we are conducting in-depth interviews with people from different professional backgrounds. So to incorporate their expertise into our learnings and also to understand how that particular field can contribute to an idea of an ideal society.
Beautiful.
Okay.
Okay.
So now that I'm talking about an ideal society, I would love to know how you envision an ideal society for yourself.
I think for myself, I think safety matters a lot to me. And when I say safety, I mean safe spaces, right? It's not just about physical safety, but also emotional safety and the ability to access resources for everyone. One thing we tend to forget in our rush of everyday life is that the sense of community becomes very important. It's important to have a community where you can reach out for things, even if you're an absolute introvert or you like staying quiet and in your corner, but you should never feel unsafe in reaching out for help at any point. And this community at the same time should also be able to reach out to you to connect you to somebody else who needs you. And it's a two-way street. Like caring is a two-way street. It's not just somebody else cares for you and you don't care for that person back. And this works in every setting, right? In an organizational setting, if an organization is caring for you, you need to care for the organization as well because that's how relationships go. It's a quid pro quo. It's that one-sided thing. It's very romantic in films and television. In real life, it doesn't really work that way. And I think for me, an utopian place is where this two-sided interaction is there. The thriving is there. It's a safe space for everyone, irrespective of who you are, right? It is something where uh, people are not people are not like suffering or struggling to access that community wealth. or the community ecosystem or services. That to me is utopia.
I think you brought an important point. Like, we need to build that ecosystem where everyone feels supported and have a safe space where they can experience, where they can like talk about what they are feeling and can support each other in their growth. So, like you have been a part of a number of organizations and you have worked there. So, can you talk about some of those projects that you were part of and that had a major impact on empowering vulnerable communities in SRHR?
To start with, the first project that I worked on was with NACO. Now, I entered NACO as a fresher from Tata Institute of Social Sciences. It was a campus recruitment. And the first thing that I did there was working on migrant populations and looking at how, when migrant populations are moving from one place to another place, they become very vulnerable to the lack of access to SRH services. Because you are from, say, a village in India, right? Now, you are not coming directly from that village to your destination, say Mumbai in India. So, suppose you're coming from one place in Ganjam, which is Orissa. Okay. You might stop at Surat, which is in Gujarat, and then ultimately come to Mumbai. Now, in Ganjam, you would have your ASHA worker, your ANM worker, you would have an entire infrastructure through which you can access SRH services by skipping the stigma, however you want to do it. But by the time you reach Surat, you would have lost that connection. By the time you reach Mumbai, you would have completely lost it. And now you're in a new city trying to readjust. And if you look at priorities of a community that is trying to move, to make lives, make a livelihood, make their ends meet, SRH services is the last thing in that priority list, right? But SRH services are so important in quality of life. Shivani, you and I worked very closely together for the quality of life, right? You worked with the rest of the cohort as well. There was so much we did in the consultations, etc. But tell me something, till that consultation level happened, for how many people did it actually click that SRH is actually central to quality of life?
It hasn't
It
really.
didn't, right?
It didn't. I mean, if I talk about in villages, even it is not like people are not bothered about women's sexual problems what are happening, and they just ignore it. And now we can see a participation from young people. They are bringing it, and now we can see like civil society organizations. They are working on different issues and basically focusing on it. So now it is coming into discussion. Otherwise, it wasn't.
Yeah, exactly. And this was my first project back in like many years back, right? I think it was 2010 or even before. And I think for me, that was an eye-opening because that took me to working with young people and youth migrants. So that was an intersection that people were not looking at. Youth among migrants who are leaving their villages at a very young age, either with their parents or alone, or with what we call a thekedar or a contractor in India, right? They are leaving behind with very little information on SRH protection and taking care of themselves and all of that. So when they're moving through the transit and they're moving into the destination, they're coming in as extreme vulnerability. And so if you're talking about, say, you're talking about HIV/AIDS, if you're talking about sexually transmitted infection, if you're talking about among girls and women, if you're talking about period related issues, menstruation related issues, or even among people who menstruate, irrespective of whether they identify as female or not. If you're talking about all of that, if you're talking about abortion or medical termination of pregnancy for any reason, or if you're talking about even reproductive health and services, that access was just not there because that access would get lost. It's not like the systems were not there. The systems were there. But if your system is here and your community is here, how do you bridge that gap? And I think that project really shaped the way that I thought. And that took me to a lot of other projects. So ultimately, cut to maybe 10, 12 years later, when I was working on the suicide prevention project, which was it was a very small theater-based project that we were doing. And the reason why it was a theater-based project was because we saw that theater, especially there's a form of theater called forum theater or theater of the oppressed, which helps people come out and really look at choices and consequences. So we were looking at how suicide prevention can happen that way. And when I was doing that, this entire work that I've done before that came in there as a culmination in terms of when we saw that a lot of the reasons for committing suicide or attempting suicide had to do with SRH services not getting accessed. And when I mean SRH services, I mean everything from a counseling to understanding your body, to understanding your gender, your sexuality, to looking at safety. And when I mean safety, it means about everything, your emotional safety, your physical safety, not being not being in a space where you are vulnerable to exploitation. Or if you are vulnerable to exploitation, to build those safety catchments, looking out for your friends, the sense of community. And I think these are the two projects I really wanted to talk to you about when you asked me this question. Because you never know how the dots connect, but they do. And it's important for us to connect those dots.
Very true, Shri. I think like it's important. It's not just about though you mentioned about that, though there are systems, but we don't have the people. We are like people are not aware of it. There, the way through which people could get to know about those information about those schemes is not there. So, how do you think civil society organizations or like NGOs can work to solve these issues?
If society thrives, the community thrives, the individual thrives. On the other hand, if the individual thrives, the community thrives, the society thrives. You can't get away from this. You have to take it, right? So I think for civil society organizations, we are in a very, very fabulous space because you are in a space which is a in if you look at social theory, there is a concept called micro, meso, and macro. Micro is individual conversation interactions. Meso is somewhere in the middle. Macro is the larger public policy systems and all of that. International governance is macro. A government of a country like India, which is so huge, is macro, right? Meso is somewhere in the middle. And civil society organizations typically are in the meso level. They are able to move downwards, they're able to move upwards. Or they might be grassroots organizations who are in the micro level, who are working in a community, who are working in, say, a farming village, just an example, or working in a slum. Now imagine the potential of this. You are able to move across. You are able to take information, insights, evidence from the grassroots through the mesostructure, through the macro, and have those conversations in the policy levels. You're able to understand from the policy level, translate that evidence into insights and actionable points, take it down to the grassroots levels, and work with communities. You're able to understand with the communities that, okay, this is not working. Maybe we have a great policy. On paper, it looks fabulous. The hospitals look very nice, or the structure looks very nice. But then when you work in the grassroots, you realize that, अरे इधर तो होगा ही नहीं है. It'll not work here. Why will it not work here? Maybe there is a social norm against it, which means you have to fix the social norm first, right? And that is the magic of civil society organization. For anything, if you're talking about nutrition, you're talking about SRH, you're talking about quality of life, anything that you're talking about, everything is connected, right? So if the civil society organizations are in the space where they can use almost every route which is there to make change happen. And I think that is where, to answer your question, I think that is the biggest opportunity for civil society organizations, especially in SRH. Because SRH starts with the individual, it affects the community, and then it affects the society. Whereas SRH, how we behave around SRH, access, and everything else is built by society's social norms, which affects the community, which affects the individual. And civil society organizations are just in the middle of all of this with the freedom of movement. So can you imagine the dots that they can connect? It's very exciting.
But like you talk about that when they are civil society organizations or when particular organization works at the ground grassroots level, you mentioned that certain things do not like do not work out. There are problems like you talk about, mentioned about social norms, stigmas. So how do you what kind of strategies that we can design at grassroots level to overcome those taboos or social practices that happen in villages? It could be about masculinity, it could be about stereotype, and what could be possible solutions to it?
There are two schools of thought. One school of thought says that people don't change. Okay, people fundamentally don't change. So what you invest in is different. There's another school of thought which says that people are constantly changing. And you have to first believe in one of it. Now, if you believe that people don't change, you will give up very early. So you need to first believe that yes, there is a possibility of change, and there is always a possibility of change. If you look in your own families, right? Like I know for a fact that my family was very conservative for the longest time, and now they've reached a point where they have accepted the fact that I'm 36 years old, I'm not married, and that is fine. Okay, and that is something that took them a while to arrive at. It took many generations before me for that mindset to change. It took my mother, my grandmother, my aunt, my great grandmother, all of them to do tiny, tiny things so that today I can walk around in this world being an unmarried woman at 36 in a society which still is not very okay with women remaining unmarried, right? So we still ask our girls at 18 years old, so shadi ka kya khal, right? We still do that as a society, although we have progressed significantly. Now, um, when you are at a grassroots, if you start believing that change will happen, but it will happen over time, you have to start looking at what pieces you need to move. Let's take masculinity as an example. You brought that up. Suppose you are in a village which is extremely patriarchal. And when I say patriarchal, I'm not saying it with any judgment. There are pros and cons of patriarchy, like for everything. But it's a system. We accept it. We also know that there is a system that we accept the fact that it's a system. Then we say that, okay, now patriarchy is here. This is where patriarchy works well. This is where patriarchy is causing harm. In the causing harm piece, you have to identify what is it that for masculinity it is causing harm. Is it causing harm in terms of the actions which it leads to? Are there people in the village who, because they are trying to become that masculine ideal in that patriarchal system, is that leading them to actions which is detrimental to themselves and to others around them? Chances are you will get enough and more evidence in this case. Once you get the evidence, now you have to find out people who already share your opinion that this needs to change, and not a full overhaul. Don't go in, and this is something that I advise almost every young person I talk to. It is important to be activists, but it's also very important to know how the change will happen in a way that is sustained. There will be backlash. What happens when you have the backlash? Who are the people in the times of the backlash who will stand up with you? And you have to be willing to compromise. You will probably get 10%, 5%, 0.1% of success initial days. You have to be okay with that. You can't say that, oh, I reject this because I want the bigger thing. That's a very competitive corporate mindset, which is amazing in the corporate space. Doesn't work in social impact. So that's the mindset shift that has to happen as well.
I think it's just a matter of change that's important. And like now we can see an increase in participation of women also in the workplaces and everywhere. Like now, just because of this change only, people are moving to a society where equality is there. Like we are working on ensuring that gender equality is there, and equal safe space is provided to people from all genders. So I think it's
Yeah.
just about a matter of change, and if change wouldn't have taken place, what we are doing right now wouldn't have been possible because it's just
You
not.
know, I yeah, you have hit the nail on the head. People are very scared of activism. They are very scared of being a very vocal change agent. But the thing is that because there were vocal change agents in our past, we are where we are in the present. And I think it takes all kinds. It takes the moderates at the grassroots level to push gently, quietly. It takes the loud ones who are on out there picketing, parading, screaming slogans. It takes that also to create that noise. It also needs the passive ones who are at the back end, who are not picking a side but who are pushing in their own way, very quietly. And I think the time has come to appreciate all of them. And we should stop putting one against the other.
So Shri, right now, you are working on a project, Academy of Wellbeing, in partnership with UI UNICEF India. So how do you think facilitating young people and talking about bringing opportunities for young people and making them part of the decision making process at the policy level? So how do you think those changes can create a ripple effect and help in creating an ideal society?
I think it is about moving from a beneficiary approach to an owner approach. See, it is something like this. For the longest time, young people in every society, not just in India, were treated as beneficiaries of whatever others were doing, right? So there would be a system, and the young people would be the recipient of that system. And as a result, what would happen is that the system often didn't work for the young person. Like, for example, if we look at access, going back to our earlier conversation on access, if I create a system in which access is limited to majority, saying that it is only after a certain age that you can access ABC, or a certain life situation that you can access ABC, then I am cutting out a lot of the population from accessing services that they might need it. Now, if I have those very people who I had been cutting out as part of the people who designed the system, they know what they are missing out. They know what they need, and they are able to dictate that. And I think that becomes important.
And even more, if we see most of the policies that are designed, I'm if I talk about from sports only, people from other genders, if I talk about LGBTQ communities, many transgenders, they are not given that much representation in sports. And even if I talk about other policy at policy level, that representation is not there just because these people were not part of those discussions when decisions were taken up. So I think through these efforts only we can bring a change.
I agree. And also, I think representation is of two kinds. One is there somebody in the room who will represent you when you're outside the room? And does that person know you well enough? Does that person know your profile well enough? Think of it from a macro space. Is there a policymaker in the room who knows the community so well that when they speak and what the community speak is absolutely synced? Does it happen? Sometimes. Is it difficult to happen? Very. The other way of representation is actually having that community person in the room, wherever that community, whoever that community is from, where that community person is able to speak for themselves, right? Will it be 100% adequate representation of every person in the community? Maybe not. Will it be closer to the 100% than that policymaker who is trying to represent? Yes, it will be. So, what you said, like it's about representation and it's about how you do the representation.
True. So, the main vision of UNICEF is to prepare young people to transition from education and learning to productive work and active citizenship. So, now we are working on ensuring that equal participation comes from youth, and it's not just about one gender, but being very inclusive, including people from all the genders. So, I would like you to reflect on how gender equality in the workplace can be ensured and how equality in workplace can impact the effectiveness on the field it is associated with.
I think, I'll, to be honest, the way that it has to begin is with active equality. There is something we often talk about equality like it's a concept, but it has to be in practice. It has to be in everything in terms of opportunities. It is also about equity, not just equality, right? There is also a lot of debate on equity versus equality, which has been going on for centuries now, I feel. But I think it is extremely important to kind of look at how is it that it'll translate into action at every stage. So when you have more and more young people with this mindset coming into the job space, and not just job in the sense of payment related jobs, it could also be something that young people are starting not as a employment point of view, but general active citizenry actions. It could be being part of council meetings, being part of different meetings. When you bring up these things and we are on the other side and having these discussions, that voice is in the room. If that voice is in the room, other people are compelled to listen. And when people are compelled to listen, they are compelled to act. But if that voice itself is not starting, the listening doesn't happen, the action doesn't happen. And when this happens, again, I'm going to go back to the individual community society. If you go back to that, that ripple effect will happen. It has to start somewhere. And I'm very glad that you guys are doing this. So, yes, over to you.
It's like you mentioned, like it's about inclusivity and it's about accepting our differences and living in harmony. So how can we ensure that society embraces and supports the LGBTQ community and that people of all gender identities and sexual orientations feel respected?
I think it is about actively every day doing what it takes. Sometimes doing what it takes just means being who you are. It means being brave in doing what you are doing, right? And again, this will take time. The embracing will take time. But are some parts of the society embracing? Yes. Will that cause a ripple effect? It will. Social norm doesn't change overnight. So the idea is to change the social norm one bit by one bit.
So this brings to the end of our like question series. Thank you so much, Shri. Like really it helped us a lot in understanding how we can how we can like bring more young participants, like how we can do how we can engage young people at the policy level, and how these like the shift in mindset doesn't come in one day. Just you just told us that, because it will come slowly and it will come through actions, through community led projects that could help in behavioral change. And I think even the like the youth perception survey report that was also like presented by UA UNICEF India, that also talks about how if we want women participation in the workforce and the non-traditional job roles, there also we can increase participation only when there is a change in perception of the society, how they are like perceiving about these jobs, and how we can do. And this is it's just not about the government policies, but it's also about how at a personal level we can do the we can improve, like we can work on ourselves and as like about the whole community. So thank you so much for coming here and like talking about these things.
Thank you for having me, and I wish you the best. And I think, like I said before, it's fabulous the stuff that you're doing. And don't lose hope and just do your thing. We are all with you.